If you want to come off benzodiazepines like Xanax, alprazolam, Klonopin, clonazepam, Ativan, lorazepam, those are the three probably most common, but there are other ones like lyrium chlorodiaze epoxide, florazepam, temazepam, oxazepam. The ones for practical use are Xanax, Ativan, and Klonopin. Basically, you either want to get on Ativan or Klonopin. If you're on Xanax, you want to switch to Klonopin and then come off Klonopin. You do that, it's a 1-to-1 ratio of Xanax to Klonopin. Then you overlap with Xanax the first week because the way the drugs hit the body is a little different. You want the Klonopin to build up so people don't feel distressed. And once you're on Klonopin, then you come off of that. How do you get off of that? Well, it's roughly 10% every 2 weeks. Depending on the dose, you're looking at 5 to 6 months if you've been on it more than a year to do it comfortably. I use secondary meds. So as you're slowly titrating down and you're not using alcohol to supplement yourself because you're missing the Xanax, Klonopin, or Ativan, can't really drink. I use clonidine to block some of the withdrawal. I use Ambien or Lunesta to help with sleep. I can use Neurontin or Lyrica to minimize some of the anxiety. Every once in a while, when people get desperate, I may use quetiapine, which is Seroquel, for sleep. Trazodone could be used to minimize anxiety during the day or at night to help with sleep. It's a long haul, and it takes a lot of time, it takes patience, and it takes commitment. The Ashton method is roughly that. I've had people roughly try and stay on that. Everyone's different. Sometimes you may need to put an accessorize to minimize anxiety. Some people get fatigue, and in those cases I add modafinil, but it is a symphony of things that come together to get you off. And it's a process. I usually meet with people once a month for 6 months, and then I have an electronic tether to them all the time, and I try and I prescribe all the meds at once, but we don't start all the secondary meds at once. You may have 5 or 6 medicines, but we only use them as the problems arise. And as you get into withdrawal further and further, depression can occur, anxiety can occur, insomnia can occur, panic attacks can occur, worsening symptoms of obsessive-compulsive disorder, post-traumatic stress disorder, a secondary condition. A lot of people, they don't tell me, and they start like experimenting with kratom, or they mix in marijuana or alcohol. That's a disaster. If you want to come off, you've got to commit to coming off. It takes time, it takes patience. There's no easy way out of it. It's affecting the GABA A receptor, and it takes months for that receptor to rebound. If you're coming off of opiates, that doesn't take that long to rebound. That one can rebound fairly quickly. A couple weeks, you're feeling okay. Not with benzodiazepines. It's a long haul. And sometimes when people have been on it 20 plus years, I'm almost like, we can try it, get it down over years. That's the best I can do. Thank you.